Hello and welcome to the 5th episode of The Special Relationship. I am Rachel Richardson and I am British, and this is Nicole James and she is American.
Hello.
Hello, how are you?
I'm fine.
I have a question for you based on the last episode.
Please.
A lovely listener, we have them, commented that I should have asked you how to pronounce this word. It's a place name.
God, no. Well, for us, it's a sauce.
Sauce?
And I think, God, I don't even want to say this in front of you. I think I'm going to say, my God, Worcestershire?
Yeah, it's Worcestershire.
Worcestershire. So it wasn't that off. Do you guys have the sauce, though?
We do have the sauce.
Do you call it that?
Yes, and it's named after this very place.
So how do you say it?
Worcestershire.
Worcestershire. I think I was trying to be a little bit more British. I think if you weren't around, I would have said Worcestershire. I mean, honestly, fuck you guys, to be honest.
Well,
there's 18 letters in there and it's 2 syllables. How does that make sense?
You did say last week when we were talking about this in detail that it's our fault, and I think that is true.
It's our fault. It is, and you guys are snobs about it. So it's like, whatever. You like colonize the whole world and then you're like, you don't say it right? Like, I don't think that's my fault.
We're so arrogant. We are. British people are very arrogant. And then we're just like, yeah, this is just how it is. I'm sorry. This is how it goes.
Yeah.
I'll tell you what we do love doing, though. We love arresting people.
God, it seems so nice. What's that
we
like?
We love consequences.
Yeah, what's that like?
Well, I have a question for you. What it's like here is it's a frenzy. But what is it? What are the Americans saying to the fact that we're arresting princes, former princes? We're arresting the former ambassador to America, like literal cops showing up at their houses, searching their stuff, arresting them.
I think we're really jealous. I think we're waiting for that to happen here. I think we're also confused. The other thing is I do feel like there is always a little bit of a separation once the royals get involved. I think people just get still really confused as to like, who are they? What do they do? Like, I think people knew that Prince Andrew was involved with Epstein. And so it makes sense that there's an arrest. But I think it's still sort of separated from us in a way that I don't think people quite understand. Mendelssohn, I don't think anybody knows who that is. And I think unless you're truly like getting to page 5 or 6 of the newspaper, which so many people are not these days, maybe even just miss that, don't really care or know who that is. I think there was news this morning, the day we're filming this, about the ex-prime minister of, is it Norway, who attempted to kill himself because he, is maybe going to get in trouble for Epstein too. So I think all of these together are starting to feel like something, but I think individually, especially with Prince Andrew, like even when you texted me, I was like, I don't really get why this is that big of a deal. But maybe because I thought someone would get arrested eventually, and he just seemed so, I mean, there's photos and there was just seemed to be such a
He paid off Virginia Giuffre. I mean, he gave that woman money for silence. It's shrouded in mystery, as these things always are, but he essentially bought her silence.
Yeah.
But also, it's not completely clear, but the good money says that these arrests are not over any seeming sex crimes.
Yeah, right.
They're about essentially sharing government documents with Epstein. I mean,
I think that's going to be where so many things fall, because I think the sex stuff gets so hard to, truly prove, unfortunately. And so I think it is nice to sort of see an example be made and like, how can this happen going forward? Because I think a lot of people have questions here. If people do start getting arrested here, like, what are they going to do? But it's like, I don't know, is Trump's administration give a shit if anyone's sharing secrets? I mean, this man had boxes in his fucking bathroom in Mar-a-Lago. Like, I don't know that we're like chasing down the doors of anyone who's like sharing secrets when he's literally shitting in the room with them. So I don't know.
One of my favorite pictures of all time were those boxes just like shoved up against the toilet.
It's so American. I mean, it's the most American shit ever. But yeah, I would say generally, I was just going to say, I think generally we're jealous that you guys are doing arrests and hopeful maybe that ends up stateside.
Okay. I like that. You know who we would also arrest? Maybe not arrest, but would definitely lose their job? Kash Patel.
Oh my God. You're talking about the Olympics and him fucking chugging beers. Meanwhile, people getting killed by ice, Nancy Guthrie missing, most important story in the world, Nancy Guthrie missing, the Epstein predators on the loose all over the country, and running the government. Yeah, for anyone who missed it, there was this very embarrassing ass video of Kash Patel in the locker room with the U.S. hockey team, like he's on the team after they won against Canada, chugging beers, being the fucking loser that he is, by the way. And people are like, hold on a second. My tax dollars paid for this guy to go there, the head of the FBI, to chug beers with this hockey team. And then they're on the phone with Trump and he's on speakerphone in the locker room. Did you see that part? When
Yes.
he said he's going to invite them to the White House. So go for it. Fine. I will think very much less of you, U.S. hockey team. I don't give a fuck about your medals. And then, but how he also has to invite the women's hockey team too because they also won. But like he has to or else he'll get in trouble. I'm like, you guys are all losers. I don't care if you have a gold medal. You're a fucking loser to me. And Kash Patel's like the king of the fucking losers.
Things that I find very strange as a British person. One is that like that person in such authority would ever do that or think that that was okay or like would retain their job right
We're
afterwards.
so beyond that point. It's so
I mean,
cute that you guys think that is like
it was just
unacceptable.
wild. Like we love an inquiry, we love firing people, we love arresting people, like we just love doing all of that. And there is still, I'm afraid, a standard of like if you're in public office, things you can't do. Like the deputy prime minister who well, the ex-deputy prime minister, she is no longer. Like people were calling for her head all the time when all she did was like go to Ibiza and like stood behind a DJ in a booth. Like people thought that that was outrageous and she was like on her like vacation, right?
Was she using state funds or no?
No,
because also we paid for him to go.
No,
We
on her
were
own
paying for all that
time.
security. Yeah.
No, on her own time. She was just like, I think people were sort of suggesting she was using her sort of connections to like, you know, get to the DJ booth or whatever. But like our standards are like, we just love exacting our standards and shaming people. We love that. But the thing that I cannot fathom is that sports people were like into him being there. Like, why?
That's why I said they're losers. I
Why?
mean, if you want to be friends with Kash Patel, you're a loser.
like-
I don't know what to tell you.
They were like hyped that he was there.
I think because it's the power of the state. It's like the power of the office is like in their locker room. Do you know what I mean? Like they're in with like the biggest man in the land. So they feel powerful. They feel powerful and like they're in the ultimate in crowd.
So weird. I'll never ever understand it. Never ever
No.
understand it.
No.
That is a perfect segue though into something else that I will never understand. And it's healthcare.
Finally, the long-awaited episode. I have been sitting on so much stuff I need to say about this. I cannot wait.
Is the only reason we are doing this podcast because you need another forum to share your thoughts
To yell about this.
the
Yes.
American healthcare system?
That's why I agreed to this. Yes.
There is a backstory here. Me and Nicole met in 2015 and we started working together then. And I was a British person, dropped into this crazy tech company with no idea how anything worked. And I don't know, there's like a certain day each year where you've got to like decide on your medical benefits. So I'm like given all these forms, everyone's talking about it. I've got absolutely no idea what's happening. I'm like, what is this? And I literally just like copied Nicole's form. I'm like, I'll just do what you're doing because I don't know what any of this is. I don't know what any of it means. And honestly, 10 years on, I'm still not that clear. I do understand some things more than others, but the American healthcare system has just been a mess, just in terms of how it works, why it works the way it does in general. But I think what I've never, ever understood as a British person who comes from a country where we have the national health system, where it's free at the point of use and it's a sort of general taxation system where you know, your tax money goes into this pot and then you can turn up at a hospital with half a leg and they'll fix you up, or you get cancer and they'll care for you, is just why it's so fucked up. So my question is, why is the healthcare system in America so fucked up?
I need to limber up for this. Yes. So I'm going to get a little into the weeds in the history. I'll try to go as quick as I can because it's not that exciting if you're not as into this as I am. But I think the short answer is it's fucked up because of capitalism. And when there was a point in history when we could have made the switch to nationalize healthcare, there's been a few of those points throughout history when we said, no, thanks. We're going to keep it the way it is. Basically, just to take you through the history a little bit and then wind up where we are now, which is in a fucking cesspool of just stupidity, frankly. Like the way that we do this is so stupid. and cruel and barbaric, if you ask me. But essentially, I'll take you back a little bit right now, but through, the early 1900s, most Americans, it was a very vast, huge country. They were not dealing with the hospital system very much. You would basically, if you were poor or you were very, very ill, you would go there to basically like die, essentially. As the 90s came up, and vaccines got better and technology got better and medicine got better, there was more and more reason to start more regularly seeing the doctor, going to the hospital and actually being treated, not just being cared for before you died. And so this was all happening leading up to the Great Depression. The hospitals sort of saw what was coming, were feeling the financial impacts of the Great Depression and said, shit, these people can't afford to pay for their service anymore. How are we going to fix this? So they came up with the concept of prepaying for healthcare. So to get people basically on essentially a subscription plan, pay for their healthcare every month for certain services. And obviously this is like a very, very small, offering of services back then. Pay for it up front, and that will keep our revenue going so we can continue to run the hospital. And it sort of gives people this kind of insurance to be able to pay for what they need to pay for. The very first group of people to do this was a group of nurses in Dallas, and they were paying 50 cents a month for their prepaid healthcare, which is $7 today in today's dollars. This was happening in the 1920s through the Great Depression. As the 1930s went on and the Depression got worse and worse, there were more of these employer-funded healthcare plans that were popping up that were really meant to fund the hospitals. This was never meant to be like a worker or an individual taxpayer relief. This was always meant to fund the hospitals and to make sure that the hospitals got their money. Once the war hit, World War II, the US government got very, very scared of inflation. And while all of these men were going off to war, they still needed other people to work these jobs who stayed back. In order to entice these people, the U.S. government said, you can't raise wages. There was a moratorium on raising wages. So in order to entice other people to come take these jobs, they had to give them other kinds of benefits. That's when the employer healthcare system really took off, because it became a great benefit for these people who were taking these jobs. And crucially, I think it was in 1943, government declared that these healthcare subsidies were tax-free. So not only did it benefit the employee, but it also benefited the employer. And according to my research, that was sort of the nail in the coffin of us ever turning the corner again to go back to nationalized healthcare. And you might ask, why did we go this way when during the same time period, so much of the rest of the world was going the other way? They were doing nationalized healthcare. They were signing these big sweeping bills to get everybody taxed to make sure, that people were covered. There's 4 reasons for this. There's many reasons for this, but 4 that I've sort of bulleted here. The first one being that America in general, as we've talked about much on this podcast, is very skeptical of the government. We don't like the government. It's really baked into our history.
It's a constant theme.
It's a huge theme. You might argue it's a huge problem. We really don't like the government. And this is, if you're considering World War II, we're not, not even 100 years after the Civil War, states' rights is still very much like a thing. Like, we still are talking about states' rights at this point. And the idea of government overreach is very, very scary. So I think to the general public at this point, during World War II, when we could have started this nationalized healthcare system, people were like, I don't really trust the government to run something like this. I'd rather just, deal with this on a local level with my doctors. Another reason is the doctors. The doctors at the time were kind of weirdly powerful when it came to them versus the government. The American Medical Association was one of the strongest lobbies in the US, and they thought that if we nationalized healthcare, they would not be making as much money. And so in other countries in Europe, doctors sort of organized into the system when some of these nationalized healthcare systems were popping up in Germany and the UK, et cetera. Whereas in the US, doctors were organized against these systems. They wanted their money. They didn't want, they saw it as this was going to come take their money. So they weren't interested. 2 more reasons before this starts to get really boring. We do not and did not have a strong Labour Party. The UK has always had a strong Labour Party. Germany has had a strong Labour Party. The United States has never had like a super strong Labour Party. So there wasn't really like one main organizing place or organization to come out and say, we demand this together. Again, very huge country, a lot of different interests, a lot of moneyed interests. One final reason why we didn't choose nationalized healthcare when we could have is because we're very racist. Again, another trend that I think
Common theme.
you picked up on during the course of this podcast. When some of these conversations were happening, Southern politicians were very, very scared that nationalized healthcare would integrate the hospitals. And of course, we couldn't have that. And they also thought it would empower Black workers. And of course, we couldn't have that either. As the years have gone on, this thing that was maybe meant to be sort of a stopgap during World War II has become the law of the land, the way that it is. And I think us looking toward national health care or a single payer system, Medicare for all, whatever you want to call it, is we are facing such an uphill battle because this is such a hugely moneyed, complicated system where a lot of people, none of us, but a lot of people are making a lot of fucking money. And in order to undo that, you would need people to voluntarily say, I would rather not make that money. I actually think there's a better system and I volunteer to not make as much money. So that's sort of like why we're at where we're at.
I can see why that's the issue. Why do you think more Americans aren't on board with this idea of like a nationalized system when so many other comparable Western countries have systems like that?
Well, I think there's a lot of propaganda. I think, if you come up to a Republican who might be against Medicare for all, there is a lot of propaganda about you don't get to keep your doctor. And there is this whole myth that Americans love their doctors. I don't know. If you talk to an individual person on the street, I think there's some people who probably love their doctor, but I don't know that the average American is like, I love my doctor. I think especially for younger Americans who, myself, for example, and even, younger than me, we didn't grow up in the time of like a GP that you have for, the first 25 years of your life. Like, I go to One Medical that's owned by Amazon. Oh, it's like a clinic where I can just make an appointment online. I'll see whatever doctor. I happen to have now seen the same doctor a few years in a row. So I guess she's my doctor, and she's lovely, but no offense, I don't like hold warm feelings for her. So I think there's a lot of propaganda about like just being thrown to the wolves. You're going to be seeing some crazy government worker in a lab coat who has no idea what the fuck they're talking about. Whereas, you must love your doctor that you currently have right now and you want to keep going to him, right? So I think there's a lot of that. But I think the main the fact is we would have to raise taxes to do this. We would have to or relocate money that's already going to the government, like our extremely outsized defense budget. We would have to take, because that's where most American tax dollars go, is to our military. We would have to, if we didn't want to raise taxes, we'd have to reallocate some of that money to start to implement Medicare for all.
What you're essentially saying, though, is that there is already this sort of like skeleton equivalent to the National Health Service.
Yep.
That old people, basically 65, although 65 is not that old really in current world terms. But look at Jane Fonda. Okay, but 65 and up are allowed to use this system, which I'm hearing you say it's not like fully comprehensive, but you're not going to be like left to bleed out on the street and you're not going to get a sort of a medical bill from the hospital that's going to bankrupt you. So you have this system that essentially could be expanded.
Yes.
What if people were to pay the money they pay a private company, but then pay Medicaid?
Medicare.
Could that work?
Yeah. I mean, there's 8,000 ways that people have suggested like slicing this cat, all the different ways in which we spend our current money on healthcare. But the problem is it would be a tax. It would be a new tax coming out of your paycheck. And regardless of whatever that benefit is, getting Americans to agree to that is historically very, 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 very difficult. difficult. So even though, some of the numbers I have here, and I have to consult my notes for a second, it is, there are many, many studies that show if we did a Medicare for all, if we did eventually, go into the system, not only would it save about 68,000 lives a year, we would also save 13% annually on healthcare costs, or about $450 billion. Because we pay currently, the United States pays, let me find my number, $4.9 trillion a year into our healthcare system, or about $13,400 a person. That's what we
Ooh,
pay for.
I have the adjacent stat.
Yeah.
Okay, so in Britain, the government, because we have a nationalized health system,
Mm-hmm.
the government spend about $3,500 a year per person.
It's like unbelievable. And
And
we
that
spend
is
13.4K. Yeah.
right. So that is, let's do some fast maths. That's like 4 times, you're paying 4
Mm-hmm.
times more.
More than 4 times. Yeah.
But also, I want to do a quick little rundown of like what we get versus what you get, because that's
Please.
also the thing with the American system, which I've never quite understood, that you pay all this money, but then you don't get anything for free. You then still have to pay more money.
Mm-hmm.
So in the British system, comes out of your taxes. If you're in a car accident and you turn up at the hospital, you will be patched up and sent on your way. If
For
you have
$0.
$0. If
Okay.
you have cancer and need 3 years worth of treatment, you get all of that treatment, $0, costs nothing. If you were to have a heart attack and you get rushed to the hospital in an ambulance, you'll be looked after and taken care of in the hospital and sent on your merry way. All operations, every single operation, free. Most people do not even pay for their medication. Only 11% of prescriptions people have to pay for.
And what are those? Are those like extra special, like?
No, it's more like someone like me who doesn't have like a long-term chronic condition, who's not pregnant, not low income, not a pensioner, not old, right? So it's like, it is getting to like, a sort of a small proportion of people. And I don't know, say for example, I have, I don't know, I'm just going to make something up, a verruca, and I need like some verruca treatment.
What's that?
Do you not have those things? That's like like a skin condition you'd have on your foot.
Ruka.
Okay, I'm going to come up with something better. I
I
have a
don't know what
nasty.
that is.
Okay, I have a nasty. I love it. We're just constantly unearthing things that people don't understand between
What?
this Atlantic. Right. I have a nasty cough. I have a chest infection. I need like an antibiotic. Right.
Okay.
I would, as someone who's not on benefits, like not low income, not pregnant, not an old person, I would pay for that one-off treatment, right?
Interesting. Okay.
How much does that make? But I wouldn't pay for any of the appointments or anything. The doctor's free and everything. It's just to get the medication. How much am I paying for that medication?
£4.
£9.90.
Okay.
Fun fact, that's only in England. If you live in Wales, Scotland, or Northern Ireland, free.
It should be. I'm kind of surprised that they make you pay for like
They
a
do.
cough medicine. That's kind of weird.
There is a cap. So if you are someone who needs lots of medications, either you are exempt because you're like so ill, you kind of become exempt, or if you're not, there's like a cap, which I think is something around like £300 a year. And
Yeah.
once you get to that limit, you don't have to carry on paying. So it does avoid, people being sort of weighed down by the cost of prescriptions. Okay, but I'm using that example because when I had medical insurance, and thank God, I'm touching all the wood, I didn't have anything wrong with me. It wasn't like I needed to go to the doctor very regularly. So I would, I don't know, once a year have to go to the doctor to get a test, or to like, I cut my hand open once and I had to get stitches, or like, I don't know, things like female health, like to get a smear. You call them something else, pap smear.
Pap smear, yeah.
I mean, all that sort of stuff, right? Whenever I did any of those things, I still got a bill, and I never ever understood what was happening, because
We don't understand it either.
knew that money, and I honestly have no idea how much it was coming out of my account, like out of my wages every 2 weeks. Also, we should definitely do an episode on the 2-week pay cycle. Very strange.
What do you guys do? A month?
Generally every month. Yeah. At the end of the
Interesting.
month. Yeah. But it didn't seem to cover any of my medical costs. And so in my head, tell me if I had this right, I was like, oh, this is almost like catastrophic cover. This is for like when things get really bad. But please tell me that I might have that completely wrong too. How does it work?
Oh God, how does it work is such an interesting question. So basically, so that yeah, what happened was you basically were like it was so fascinating when you came to work in America because I sort of got to see I've been railing against the healthcare system since I was like conscious, since I could like first go to work. I was like, wait, what the fuck is all of this? I've hated it forever, and I would love to live to see the day of Medicare for all. I would love it. And so it was interesting to see you sort of get dropped down like an alien into America and try to figure it out, and me see it through your eyes and be like, see, I'm not fucking crazy. Like, this shit is cruel and barbaric. But basically, when you go to work, when you get a new job, they will give you a packet of information electronically at this point, and it is all of your healthcare insurance like information. And through the employer, they have a deal with Blue Cross Blue Shield, Aetna, Primera, whoever the provider, whoever the health insurance company is, and they get subsidized, are able to offer you subsidized healthcare through the company. So they'll say you get to choose from 3 plans. Plan A is the cheapest plan. And where we were working at the time, rolling high on the hog during like peak tech days, we didn't pay for that at all. That's very rare for a company to
We
completely
didn't?
cover. No. Well, the bottom, the lowest tier, I believe you didn't
Was
have to pay
free.
for it all, completely
Okay.
free. And
Right.
fun fact, back when they first started doing these plans during World War II, all of these plans were fully paid by the employer. You sort of ask yourself, how did we let this creep into how am I paying for this? How am I? Anyways, it is subsidized. So the lowest tier was free. The second
Subsidized
tier
by the employer. Someone is picking
subsidized
up the
by the
bill, though.
employer.
So the
Yes,
employer
but
is paying for my
because they're
healthcare.
buying through Aetna or whatever, this huge plan, they also get a discount.
Got
Because
it.
you know what I mean? They're buying, 600 employees plans, so they get a discount and therefore allegedly bring the discount down to you.
And how many levels are there?
It depends. Usually there's like 3. Usually an employer will
Okay.
offer like 3. So
Basic.
mid-tier is like basic, intermediate, and advanced. But the thing is, and I used to have crazy hypochondria, health anxiety. I'm, single. I'm always just buying health insurance for myself. I would look at these plans every year just in a frenzy, like, how much should I do the highest tier? Because what if something happens to me? Because when you get this paperwork, it's truncated, but then when you go to, click the link to see the full benefits, you're looking at 20, 30, 40, 50 pages of, all of these caveats about the things that are covered, not covered, what your copay is. Copay is we could do a whole fucking episode on what
But
a
please
fucking
try and
copay
explain
is.
copay. Please
A
try and explain
copay
that,
is
though.
basically, so you pick your plan. Let's say you go with the lowest tier plan. You are saying, I will pay X dollars a month for my health insurance, and my employer will pay double that. So we'll cover it together. Through that, my deductible is my monthly rate, and then my out-of-pocket max is once you reach a certain limit every year. Let's say my out-of-pocket max is $4,000. Once I hit $4,000 on any medical coverage that I end up paying for, then the insurance company comes in and they pay for the rest of it. And so you might be asking yourself, wait, what's the deductible for? Aren't I paying for my insurance through that? Does the deductible count toward the out-of-pocket max? The answer is no. The out-of-pocket max comes from things like copay. So when you go to the doctor and you're just going for a physical, it's February for me. Every year I got to go to the doctor. I got to get a physical. The doctor charges you basically just like an administrative fee, like of anywhere from $30 to $60. For a specialist, that can be up to $100 a visit, $200 a visit. A general doctor is at least charging at this point, 2026, at least probably $35, $40 just to go to the appointment to see the doctor. This has nothing to do with the monthly fee that you pay every single month that comes out of your paycheck, but this does go toward your out-of-pocket max. So for example, you go to let's say you're someone like me, you don't thankfully get sick that much. You go to your doctors, you pay your copays, and your copays over the year come out to be, I don't know, $250, $300. You just pay that out of pocket. You don't get anything for that. But let's say you're then in a car accident and you end up being in the hospital for 2 weeks. you will probably hit your out-of-pocket max because from that hospital bill, insurer will also ask you to pay a percentage of what those services cost. So if you had a hospital bed every day, which is like, I don't know, is it $700 a day? I have no idea what these people charge. I mean, they charge, that's a whole other episode too, is how much the hospitals charge for, giving you a Band-Aid. I mean, there's TikTok after TikTok of people who get itemized bills from hospitals showing you every single thing on their list, and they'll charge you $250 for a Band-Aid. Okay, so let's talk about you want to talk about fraud and waste. Let's fucking talk about the goddamn hospitals. Anyways, you end up paying a percentage of the bill that's sent to your house. Having a baby. I think the average cost, I should Google it right now, but I want to say it's like $50,000 to have a baby in the United States. The taxpayer, the person going, if they have health insurance, ends up paying a percentage of that. So it might cost you, I'm making this up, it might cost you $3,000 to have a baby, $4,000 to have a baby, and that's out of pocket. And
$1,000 to have a baby.
well, yes, I should Google. I really should Google it because I'm talking out of my ass and I don't want to take time to Google it right now while we're recording.
I'm going
But
to Google it.
it costs money to interact with the healthcare system in any way. So the problem is my example, $4,000 out of pocket max, is very low, very, very low. That would be considered like a great healthcare plan. Most people's out of pocket max is like, I don't know, $12,000. So it's like insurance isn't even picking anything up until you hit your out of pocket max. And then they come in and say, oh, okay, you can't pay this. So we'll go ahead and pay this. But the thing is, when you were dropped into Snapchat and you were sitting there making your you weren't aware of all of the equations that an American is doing every day when they sit down and they pick their plan every year, because you have to think ahead. If you want to have a baby, if you want to, I don't know, if you pick up
If you have children.
if you have children, who the fuck? I mean, these kids are always getting sick, breaking their legs, whatever. You have to factor all of this stuff in to the plans that you choose because you want to make sure that you're covered. So you're basically balancing, what do I think I'm going to spend this year on my health with what can I afford out of my paycheck? And none of this is a way to live, is what I always keep saying. Like, that's the thing that just, there's, as I've said, there's so much propaganda here about you don't get to keep your doctor and people in the UK have to wait for 3 months to see a doctor. And, it's like, there's so much of that going on. I'm like, but imagine the utopia of you just knowing if I get hit by a bus, the most I'm going to pay is like $12 because I wanted to upgrade from wooden crutches to metal crutches.
I think that's the bit.
The freedom there, and America is so about freedom and liberty. We're not free. You're not free when you're constantly worrying. I'm sorry, I'm on a roll now, but like, I have explained this before, like healthcare, health insurance is like there is a pot constantly. The foam is right at the top of the pot on the back burner, and you are constantly hoping it doesn't spill out over onto the rest of the stove. That's what it's like as an American with healthcare in the United States. Even for a privileged person who has a good benefits plan, you have no idea what's headed your way healthcare wise, medically. None of us do. And it only makes sense that you would just pay every month to a big pot that everyone can take out of when they need it. And I just am so jealous. I'm so jealous of every country with nationalized healthcare. I can't even get over it.
I mean, I think this is what I couldn't get my head around, that I understood that it was a paying system, but I think the biggest shock I had was that the payment that you made did not then give you access to the free-for-all care, if that makes sense.
I mean, they would say it is. They would say you getting to go to the doctor and only pay $30 is basically free. Because
no,
insurance,
the whole the copay, the out of pocket max, like that's the thing that I just found so crazy, because for me, I appreciate I was enormously privileged in so many ways, right? But I also was in good health, right? So every month I paid for this service that I didn't use. Right? I wasn't bothering the medical system in any way. The one time a year where I needed to go and get my hand stitched, I then had to pay. And I'm like, wait, I'm paying 12 months of the year for essentially nothing. Then I have to pay Then I have to pay to get my hand fixed. And then, yeah, thankfully, I was never in a situation where I got close to reaching the out of pocket max. But there are scenarios, right, where people are paying hundreds, thousands of pounds a month out of their salary for this thing, which then means they just have that essentially the right to access some of these services.
That's
But
right.
then any given year might have to get to their out of pocket max, which like could be $20,000, right? So if you have a bad year of health, you can be spending $30,000, $40,000 a year. And that's when you have insurance, right?
That's
so
right.
that's the thing that drives me crazy. And I've never really quite understood because, and I know it's different, right? But let's say it's travel insurance, right? Or car insurance.
Mm-hmm.
You pay the monthly fee and then you're very aware that there's like an excess involved, right? So you have the accident, you don't get everything fixed for free. You've got to pay the $1,000 or whatever of the excess. But the excess charges in the American system are like life altering. Like who can
Exactly. Because
lay
we're
their
not
hands
cars. We're
on
not cars.
$40,000?
Yes, you need your kidneys. So it's like, yeah, when you total your car and they're like, you could get the Ford Fiat for $0, or you could upgrade, to the Range Rover if you want to spend the extra, $300, whatever. Okay, fine. But in America, you can't even get the basic version without paying.
Okay, so what happens if you are destitute on the street and you get hit by a car? What happens to those people?
So here's the other issue. What happens in those situations, a lot of those people do not have insurance, and hospitals are required to treat essentially anybody who comes in. They are required by law to treat anybody. They don't even ask for insurance. Insurance comes in later. The insurance part of the conversation comes in later during the administrative portion of dealing with the hospital. The doctor can't ask. So what happens a lot, and we're seeing this now with the repeal of the ACA subsidies, which is a whole separate like American thing that we could talk about. It's pretty boring, but it's very crucial. The hospital absorbs those costs because they'll go out to the person for months and months and months, and they'll go to debt collection, but they're not getting that money from that person. So people just ditch a lot of these bills. So the hospital absorbs those costs, thus raising all of their costs that every single person who interacts with the hospital then has to pay for. So this is exactly what's happening right now. Go ahead.
So you're better off being destitute or extremely rich.
A lot of times that you are, and it's not even destitute. There's certain things that you can go to the hospital for, and I don't have an example in front of me, but I've seen this many, many times on videos on the internet where people have called to say they have to go get some procedure done, right? And it's going to be XXX with insurance. And then they'll call back and say, I don't have insurance. I'm just going to come in and pay out of pocket. Well, because they still want those customers, they will offer people for certain things discounts if you don't have insurance, that oftentimes without the insurance itself, just paying out of pocket with the discount is cheaper than paying with your insurance, which, by the way, again, you pay for monthly. You pay for every single month.
I do know a very rich person who does not have insurance for this reason.
Yeah, it can be cheaper.
Have health insurance because they're like kind of like extremely rich and healthy-ish, and their logic is that if they got into a catastrophic car accident, they have enough money to just basically pay for it, and they would want to have the best doctors in the world anyway.
I mean, I think where things get very, very expensive in the United States healthcare system is a long-term illness or cancer or something like that turns into hundreds of thousands of dollars, which is part of the reason.
There was a woman. Yeah. Sorry, this has stayed with me so much. There was a woman who drove along the 5. Now, if you have ever lived or driven in Los Angeles, you know the 5. She's driving along the 5, and a metal pole freak accident goes through her car.
This is my nightmare. Like from the truck in front of her.
I don't know. I don't think she saw it. It just ends up kind of coming up through her car. She's impaled by this gigantic metal thing, right? Goes through several organs. Like, it's incredible that she was alive.
Yeah.
She gets taken to the hospital. It's possibly one of the most complex cases they've ever dealt with. She has to have like repairs to like several internal organs. Yeah. This woman is in the hospital for months on end. She's now thankfully fine. Her medical bill from the hospital was over $1 million.
Yeah.
She had insurance.
And so she still probably had to pay, I don't know. Well, it depends on what her out-of-pocket max was.
She out of pocket
max. It's just, I mean, this is why I have a stat here. 36% of U.S. households have medical debt. This was from 2024. 21 have a past due medical bill, 21%. 23% were paying a medical bill over time to a provider. Mind you, medical and dental providers are thus one of the most common sources of credit to households. The debt in the U.S., medical debt, is a huge issue. And there are all of these basically like molds that have popped up around the healthcare system that we are dealing with as individual people because we simply refuse to talk about universal healthcare. And it's all of these disgusting little pockets of pain that people are dealing with because we refuse to take a look at the system. I will say, I do think that's changing. Do I need to mention Luigi Mangione to anyone? Is now a good time? Because I think what was so fascinating about that, for anyone who might not remember, he's the guy who murked the head of the United Healthcare in the street.
Well, he's pleading not guilty.
He's pleading not guilty. Sorry, he's allegedly the guy who murked the
police believe that Luigi Mangione killed the CEO of United Healthcare on the streets of Manhattan.
Yes. But the reason why he has not only become, a teen idol because of his good looks is because there's a lot of people in the United States who think that's a folk hero, who think that is a guy because of, allegedly, if it's him, we've seen that he's dealt with back issues. He's seen the way that things run. And he allegedly had, some strong thoughts about, our healthcare system. But I think there's a strong sentiment in America about our healthcare system. People hate it, but then also there is such a stronghold of people who are so terrified to let the government run it. And I do have to say, when I look at how we pick our governments, if we had national healthcare right now and this was our government, no thank you. I'm going to become a maha. I'm going to go to the midwife. I'm going to go to the witch doctor down the street because I don't trust these people. Because if every new administration who comes in puts a new head of, if we had an NHS, a new head of the NHS in charge, I'd be like, I don't want Dr. Oz as the head of the NHS. So there is this, it goes both ways. I do rail against the people who are so scared of the government, but I hate this fucking government. So it's like, how do we deal with that part of it too? Yeah. It's just it's not that complicated. On paper, you really just need everyone to pool their money into a big bucket and then everyone takes the money that they need to go get their health care. But all of the various, hurdles along the way, the political hurdles along the way, I think is what just makes it we're absolutely at an impasse. But there are people right now, I would say there's more. Because I've cared about this for so long and have paid close attention to it, I definitely have noticed there's such a fervor for this conversation now more than ever before. So maybe we'll get there, but right now it's a goddamn nightmare. And I maintain that it's cruel and barbaric. It's awful.
And a quick note on the politics. Tell me if I've got this right. So the Democrats generally are very pro sort of like healthcare for all, Medicare for all. They brought in Obamacare, which revolutionized.
No.
I have this wrong?
None of them are. There's no Democrats are not and the Republicans are not. As of right now, you could say the progressives are. The young progressive wing of the Democratic Party, the AOCs, the Bernies, they are, Jayapal. These are people who are calling for Medicare for all, but there are people from, when Obamacare was put into law. I mean, myself at the time too, it felt like a piss poor excuse toward Medicare for all because it is still so tailored toward the health insurance companies, toward the corporations. And we haven't even talked about the pharmaceutical companies and the fucking drug money. We haven't even talked about any of that. I would say none of them are, maybe Elizabeth Warren is too. There are starting to be more mainstream-ish politicians who are willing to say, hey, we should have this conversation. But for the most part, your run-of-the-mill Democrat, this is very low on their list.
Okay, tell me if I get this bit right, though. The Republicans are generally against these subsidized systems in general, which sort of fits obviously with their general politics. But weirdly, it's like they acknowledge that the system doesn't work, but they don't seem to have come up with an alternative. Because Trump
you just explained Republican politics.
Okay, because Trump
That's
did.
their whole platform. This doesn't work, but we don't have any options.
Yeah,
Please vote
that,
for me.
I have to be honest, it's almost like they're quite transparent about that bit, which I always
Mhm.
find quite funny because it's like, wow, you're just basically admitting you don't have any solutions.
That's
Because
it.
they did try, Trump in his first term did try to overturn Obamacare, but it was like, but they were just going to try and get rid of it. It wasn't like they had a different idea. Have I got that
They've
right?
never, correct. They literally don't. And that's not even me being a Republican hater. They don't have an idea. Like I
Yeah.
don't know that they've ever put one forward.
It is true, actually. There's so few ideas on the table of like how you make the system better
Yeah.
that like the only answer that actually makes sense is something like Medicare. Sorry, I keep saying Medicaid, Medicare for all.
Yeah.
Like, because no one else is coming up with any bright ideas, unless maybe
No,
there's
and
a whole.
we already have a skeleton system in place. So it's like, can we work toward expanding that? It's the thing that
Yeah,
makes the most sense on paper, you would think.
yeah.
But again, there's such a wave of propaganda that we have to fight against.
That's so fascinating. What I should, though, caution and say that whilst I do wish America had a nationalized system that was more in line with the NHS so that people weren't, bankrupted by debt, medical debt, and, could actually get help, because I do agree it's very cruel. I think even just on a sort of day-to-day level that people won't go and have checks, they won't go and sort something out because they fear this thing. And it's also very difficult for me to explain as someone who's lived in both systems. Like, you can't quantify it with money, right? But the weight off your shoulders for not having to worry about any of this stuff. Like, I have two very close friends of mine who've both had really quite horrific times with cancer, and they have kids, they don't have unlimited resources. And it was bad enough, right?
Yeah.
They got treatment on the NHS, and I think both would say they had excellent care. I just don't know how much more fucked up that experience would have been for them if they'd also had to deal with the administration of it all, the cost of it all. Sorry, I'm saying all of this to make the point that the NHS is not perfect.
No. And that's the other thing that I think Americans are up against. And we are such a black and white culture that literally, that I think the moment this conversation comes up, and it's getting a little bit better, like people are getting a little bit better having nuance in the conversation, but people immediately say, well, like you were going to, I'm sure you were going to say, I know someone in England who had to wait 3 months to get their XYZ. That is the thing that constantly comes up. And I cut you off, but I think we just shut down the conversation as soon as people say, well, it's not going to be perfect. Then it's like, that's, it's to me, it's such a lazy way to argue against it. But go ahead with your point, because I know that you were going to make a good one. Sorry.
No, I wasn't at all. But to your point there, though, do Americans think that when they do jump through all these hoops, and do they think they're getting excellent care? Do they never have to wait for anything? Like,
I think they think they're in charge. They think like just the concept of you being assigned to a doctor, or a bill or some kind of medical anything coming from the United States government, even just on a piece of paper, would freak them out. Look at what happened to this country after COVID, after being told you can't come in here without a mask. These people tried to kidnap the goddamn governor of Michigan. Like, people, we
really did get glossed over.
I mean, hello. Like, people lost their marbles during COVID because, and by the way, and that's when, and I remember because you were volunteering during COVID and you were one of the first person like handing out the shots. And we saw you, and I just remember thinking, driving up to this parking lot at UCLA and this long, long, long line of people out the door. It was so fascinating. It was so exciting. What was so exciting to me was seeing that we can pop up this system if we need to. A free vaccine in a parking lot during a pandemic full of volunteers, full of the government running it. Oh, it turns out we can do this. But people on the flip side lost their goddamn mind about it. You can't tell me what to do. This don't tread on me shit literally is killing us. Literally killing us.
Look, they do have a point though, right? Because the NHS is such a beast, you can feel like very lost inside of it.
Sure.
And it really has got a long way to go to, having like centralized record systems, for example.
Yeah.
So if you have a more sort of like long-term issue, so I have a long-term issue with fibroids, and I actually am under the care of a specialist unit who are fantastic. And every individual that you meet is fantastic, but you literally have to tell them my like 5-year history with fibroids, every single person
Every
that you
time.
meet, every time.
Every time.
Like, and you also sort of have to know how to play the system to get care. And
Mm.
when I say play the system, I more mean that like if you don't sort of have some agency and like know who to contact to sort of speed things along, you can be stuck in the system for a very long time.
Mhm.
Like I sort of self-referred myself to a unit that I'd been to before,
Yeah. I'm sure that's frustrating.
which like a lot of people wouldn't do. But I asked a doctor friend whether like how I best go about this, and they told me.
Yeah.
But if you don't, if you didn't have that time to do that or the balls to do it, because it was a little ballsy for me to ask that, but I'd been under their care before, but I'd sort of technically been discharged. That you can be stuck in the system for a very long time.
Yeah.
And the NHS is so good, right? I mentioned my friends who've had cancer. They're so good with cancer care. I mean, obviously there will be instances where people would disagree with me where they've maybe had bad experiences, but in general, most people would say that things like cancer care is excellent. If you are involved in a catastrophic accident, fantastic. If you have a heart attack, you might have to wait a while for the ambulance. You might have to wait a while to get seen. They're gonna save your life, right? Like if you turn up and you are a high priority patient, they're gonna save your life. Where it really is a struggle for a lot of people are things like long-term chronic issues, like hip replacements, knee replacements. Things that are just like very difficult to treat, like bad back. Like I've
Chronic,
got a
but
bad
not
back,
yeah,
but
yeah.
they don't quite know what it is, or it's this, or it's that, or it's wear and tear, or it's
Yeah.
arthritis, or whatever it might be. Like stuff like that's really difficult. It's We've got a very woefully underfunded mental health system,
Hmm.
which has not met the moment of like, post-pandemic mental health explosion.
Yeah.
So, you have some cases where people are waiting for years to get a therapist, if they can't afford to
Yeah.
pay for one privately. And look, the quality of care obviously can vary quite substantially depending on where you go. Generally speaking, I'd say in London, I think you do get better care than in
Yeah.
other places.
That would make sense.
Yeah,
Like, where the money
I don't have that as like a fact. I can't prove that, but just in general, when I hear about people's really poor experiences tend to correlate with them being in poor areas, very sadly. And there's also like massive issues with like social care, sort of like care within the community itself. So like, let's say this particularly is an issue with old people. So let's say an old person like has a stroke. And so, they went from living very independently to like, it would be irresponsible to check them out of the hospital without like a care plan
Yeah.
in place. The local community is just underfunded and I think a bit of an administrative mess to get things like that in place. So then you have these poor people who are like bed blocking, essentially, and
Yeah.
clogging up hospitals and all this kind of thing. And of course, there's been big scandals like, where we've had a couple of mass murderers.
You're gonna have those. That's the thing, though. It's like you can't. No system is perfect. No
Of
system is
course.
perfect. And I think when I hear about Canada or the UK, which are the ones I'm most familiar with, like I hear similar things where it's like if you need this crucial level of care, they're very very good at that and they move very quickly. And otherwise, it can get dicey. And like if you have chronic pain and it's not getting fixed, like that is very very frustrating and annoying. But to me, it just also sounds like they've prioritized correctly. If you are like about to die, they're going to see you first. And I think there's always ways to improve every single system. Oh, and this is stupid of me because I was like well into my 20s. I didn't know you could still get private care if you want it. You can go
Yes,
outside the system if you
you
want it. So if
can.
you have money, rich people are always going to be fine. Like rich people can do whatever they want. They can go wherever they want for care. And if there is something that, is really happening to bother you and you have the funds, like you can speed things up that way. You can speed things up with money, which you can do in every country in the world, basically. And I just think if America got to a point where there was a guaranteed base level of care for everybody, it would just change everyone's lives. How could
Yeah.
it not?
Yeah. I mean, ironically, if you work for a big corporation and you're a certain level, it's very likely that what part of your benefits package will be private healthcare.
Hmm.
So my boyfriend, who's a partner in an accountancy firm, he gets private healthcare, which he can choose, which is a bit like the American system. He pays a certain amount. It's actually, I don't think very much. Maybe it's like £70 a month.
Okay.
his employer pays a portion of that. I don't know what the sort of division is, but it's subsidized by his employer as a benefit. And it means he had a problem with his knee. He would have waited years to get it fixed because it was really like, he could do his job, he could live his life. It was actually more affecting his ability to run, which, in the grand scheme of things, it's a high class problem. But, it's obviously something you'd want to deal with as a younger person. He was able to go to a very fancy hospital, very fancy, and get it done all on his insurance. And, it was essentially free for him, but I think he had to pay maybe like £500, maybe as like the excess.
Yeah.
So that is wonderful. That is a wonderful system for someone like him. If he has a niggly issue that needs to be dealt with, he does that. If he is in a car accident, he'll get rushed to the NHS.
So you kind of get a skip the line pass, it seems like,
for things. But if you have cancer, the best private medicine insurance cover in the world is not probably going to get you any better care than you'd get on the NHS in Britain.
Yeah.
And if you have a heart attack, like it's not like these Harley Street doctors are equipped to deal with a heart attack. They don't deal with emergency medicine. I mean, I'm sure there are some rich concierge doctors who operate in the upper echelons of society. But if you need to be operated on in an emergency, you're going to turn up at your local hospital.
Yeah.
That is basically how the system would work.
I mean, it's just, I don't know. I feel like I could talk about this for 6 more hours. I just am so disgusted by it. And that's all to say, at the end of the day, we're spending all this money, we're doing all this stuff. We have this whole vast web of doctors and specialists and blah, 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 and blah, blah, blah. And guess what? We're still dying faster than everybody else in the world. With nationalized Medicare, our infant mortality rate higher, maternal mortality rate higher, obesity higher, health, heart issues higher, lung issues higher. We are failing. We're spending all this money and we're failing.
Listen, it really shocks me that RFK Jr. hasn't figured this all out.
Does it? Does it? Maybe the worm had all the information. Maybe the worm went to the part of the brain with the solution and ate it.
Did you see the video of him with Kid Rock?
I can't. I actually can't. My friend Reba sent it to me. She said, "Is this AI?" I said, because she sometimes has a hard time telling. I said, "No, unfortunately, this one's real."
Do they know how homoerotic they come off?
No, I mean, that could be a whole other episode, truly. I mean, conservative men are the gayest people on earth.
They are gayer than the gayest men I know.
They're gayer than men who have anal sex. Like, they are gay. They're gay.
Maybe we do need to do an episode on that. I promise next week it'll be much more lighthearted. We do like the high-low of like fun topics and then something really serious. I feel like you actually, as much as you've got that off your chest, like you physically sort of sunk down in your chair because
I did.
You're like,
you know what? Because I'm defeated.
You're in such despair at this system. But honestly, I do find it admirable. It is like, if you ever want to get Nicole to pop off, you just need to ask her about American healthcare. But it is a vital, if you're going to be passionate about something, please be passionate about other people's health. I also hope this serves as a reminder to British people that as much as our system is so flawed,
you have no idea
go to the mat.
How bad it can be.
I would go to the mat for the NHS. I really would. And I'm not suggesting for 1 second it's perfect. I'm not suggesting for 1 second it can't massively improve. But if you have seen, like I have seen, the other option, you're not going to go for that, I'm afraid.
No.
You are not going to go for that.
Thank you, lucky stars.
So helpful. Thank you for giving me all of that history. I feel much more, I guess I kind of like understand why it's so fucked up, if that makes it makes more sense that it's fucked up now that you've explained the history and the origins.
When you get into sort of like how it's like any company. It's a mess. Mm-hmm. Any country, any company, it's a mess. Once you get under the hood, you're like, this is a fucking mess.
All dysfunctional.
Well,
this was great. See you next time.
Sounds good.
Bye.
Bye.